Hi. One of the most important studies presented at the American College of Cardiology meeting in the end of March 2008 is a trial called HYVET. HYVET stands for Treatment of Hypertension in People Over the Age of 80, and it fills in one of the blanks in our understanding of what to do about people with an elevated blood pressure. This study enrolled patients over the age of 80. The average age was 83, elderly by anybody's standards. This is a group that we haven't proven benefit from an elevated blood pressure, from having an elevated blood pressure reduced, and in fact there's a meta-analysis that suggested there was harm. So many of us are afraid to treat these folks for fear that we're going to make things worse. We're afraid they're going to pass out, we're afraid they're going to get demented, we're afraid they won't benefit. A group of investigators led by Chris Bulpitt from England decided to address this problem directly. They enrolled close to 4,000 people and compared a regimen beginning with a low dose of indapamide, a thiazide-type diuretic, with an addition of perindopril, an ACE inhibitor if needed, compared to placebo. It certainly is ethical in a group of patients such as this, or subjects such as this, to use a placebo, because there's equipoise here. We're really not sure what to do. Well, after a follow-up of only 1.8 years, the study was stopped for a surprising reduction in all-cause mortality, very close to statistically significant reduction in stroke, both fatal and non-fatal stroke, which was their primary endpoint, for a dramatic reduction in heart failure of more than 70%, a reduction in coronary disease, with, surprisingly enough, fewer adverse events in the actively treated group compared to placebo. This wasn't only clinical events, but also biochemical events. So using a regimen beginning with a thiazide-like diuretic, adding an ACE inhibitor to it in most patients had no issues with respect to uric acid, no issues with respect to hypokalemia, and dramatic benefit and things that are very important. What the HYVET investigators concluded is you need to treat only 11 people to prevent one stroke. That's as dramatic a cost benefit as we can get. Thanks very much for your attention.